Hi, my name is Farah, and today I'm going to be administering medication, IV medication, to one of my patients. So first thing I would do is to wash my hands. I do have a doctor's order for Ellen Davis, date of birth 9/1963, and she's to receive sodium chloride 500 ml. Now it's a one-time dose. So what I would do is introduce myself to the patient, let her know that she's to receive her sodium chloride medication now. I would check, I would ask her name, have her state her name and her date of birth, given me 2 identifiers. And I would also look at the doctor's order to verify that it is Ellen Davis, 9/1963, date of birth, and she's to receive sodium chloride 500 ml now. I would also check any allergies, and she does not have any allergies. So I've done all my checks. Now I can get ready to hang my IV. So again, I'm just gonna wash my hands. And now I'm gonna look at the sodium chloride, 500 ml, 0.9%. I wanna check the expiration date, and it is not expired. Expiration date on it is January 2023. So what I'll do, I'll get a IV administration set going. So I would open the pack. I have my garbage handy. Okay, and again, I'm just going to verify. That's the sodium chloride 500 ml to be infused now, to be given to Ellen Davis, 9/1963, date of birth. All right, so I have a clean surface. I have all my supplies. I'm going to clamp, make sure it's the tube is clamped, so when I spike it, the fluid won't run. Okay, so there's a blue cap in the IV bag. I would discard. Not going to need that again. And then there's the this is the spike. There's a protective covering, so I would just remove it, keep it clean. So okay, all right, so then I would spike it real good, and then I would hang my IV pole. And what I would do is, even like with the IV bag, I would put the patient's name and the medication, the time, her date of birth, my initials, and the time for when we started it. Okay, so I'm just gonna have some of the fluid, just to make sure the tubing is patent and no air bubbles. So I do have a container handy, and I'm just going to remove the protective cap. I'm not going to touch the end. Okay, and then what I'm going to do is to make sure there's the chamber has at least like halfway fluid. I'm just going to do like that. Okay, so it's at least half. And then I'm just gonna like prime the tubing to get rid of all the bubbles. I'm just gonna have it slowly. Sometimes there's a lot of bubbles in some of the tubing, so I want to get rid of all the bubbles. Just let it Okay, so it's going slow. If I did see any bubbles, what I would do, and I'm just gonna cap it, protective, what I would do is to get rid of any bubbles, any air, just to so I would just do it wherever. And this usually takes care of any bubbles. Make sure everything's patent. Okay, so I think now my line is bubble free. No air. Okay, so now my line is good. Okay, so what I'll do, my clean surface, so the tubing is prime and I clamped it. So what I'm going to do is to just wash my hands again. And while I was priming the tubing, I did look at the patient's IV site. There's no redness, there's no swelling. And because I'm getting ready to infuse, I'm just going to do another check. Look at the doctor's order, which is the sodium chloride, 500 ml to be infused, 125 ml an hour, and the drops per minute, according to my calculation, was 83.3. Can't do anything with the 3, so we'll just leave it at 83 drops a minute. So I clean my hands. Now I'm going to get my clean gloves. So I just did another check. So now what I'm going to do is to check the patency of the IV line. So I will get some alcohol, get saline flush. Okay, so I have my saline flush. And then alcohol. And it's very important to just clean the IV, the port real good. So I want to do it a couple of times, you know, some circular motion. So I want to clean it real well. Okay, then I discard the alcohol. Then I have my saline. So I'm gonna make sure the line is open, and then still keeping it in a sterile position. So then I'll just flush. Okay. All right, so it flushed well. Okay, so it flushed well. So now, done my check. I got the doctor's order right here. And I checked it. So now I'm gonna hook up the IV. So everything, want to make sure everything's open. So I'm gonna unclamp. So this is open. I'm gonna unclamp. So it's open, it's infusing. I'm looking that it's infusing. Okay. So while it's infusing, then I'll just remove my gloves. So I remove my gloves, and then I'm just going to wash my hands. And then what I'm going to do is to just document on the MAR that the sodium chloride is being infused to Ellen Davis, her date of birth. I'm just going to make a note, my initials. And then what I'll do is to ask the patient if she need anything else. If not, I'm going to make sure she's in a comfortable, safe position. And she has the call light and the IV. Again, I checked and everything is going well. It's infusing, the patient's comfortable and safe. So that's it for the sodium chloride administration. Did all my checks, did everything. Thank you.